Okay, so today we're going to talk about the assignment 2, original anatomy of head questions. So let's see that. First question, that's the name of all skull bones. So skull bones, according to the Gray's Anatomy classification, been divided into 22, excluding the ossicles of the ear, and also for the lower jaw is exception, which is mandible. So except the ossicles and the mandible, the rest of the bones of the skull are joined together by the special kind of fibrous joint. We call them sutures. They are immobile. So skull bone, we can divide it into the cranial bone and the viscerocranium, or we can say the facial skeleton bone. So the cranial bone, first of all, here we can see here the frontal bone, which is single, two parietal bone, occipital bone, single, two temporal, sphenoidal, yellow color, single, and here we got the green color bone, that is the ethmoidal. So unpaired frontal, paired parietal, unpaired occipital, paired temporal, unpaired sphenoidal, unpaired ethmoidal, making the cranial bone. Now let's talk about the facial skeletal portion. We go to the two nasal, two lacrimal, this small blue color portion here representing the paired palatine, zygomatic paired, paired maxillary, paired inferior nasal conchae, single vomer, making the nasal septum in the adults. So these bones are making the facial skeleton. So 8 in the cranial and the 14 bones we got in the facial skeleton. Mandible is making the lower jaw. We are going to the next question, that is define glabella. If you look at the frontal view of the skull, the depression between the two superciliary arches here in the middle, this depression is known as the glabella. Next question. Frontal bone and the two nasal bones are joining together, this intersection here known as nasion. Next question. Name the 3 external visible foramina from the frontal view of the skull. Here we can see the both sides. Above the orbit, we go to the supraorbital foramina. Supraorbital foramina. Inferior to the orbit here, we go to the infraorbital foramina. And on the mandible, we go to the mental foramen. Mental foramen. Next question we got here, define the Pterion and tell its clinical correlation. So we can see from the lateral view of the skull, the frontal, parietal, temporal, and the sphenoidal bone. These 4 bones are joining together here, and this is the very weak point, thin point, the intersection of these bones, and it is prescribed as the 2.5 centimeter from the lateral margin of the orbit and 2.5 centimeter above the zygomatic arch. So approximately this region. Deep to this structure, the middle meningeal artery anterior branch is passing. So an injury to this point of the skull is extremely serious because damage to the anterior branch of the middle meningeal artery may produce a significant extradural hematoma, which can be fatal. The next question is the Asterion. Asterion is the point of junction of the three bones. In the little view we can see here the parietal, occipital, and the temporal bone joining together here. This point, the three interbones junction, is representing as Asterion. Next question is the defined Bregma. So we are looking from the superior view. Here we can see in the frontal, two parietal, and the occipital bone. So this is the coronal suture. This is the sagittal suture. So the intersection between the coronal and the sagittal suture, this intersection point known as Bregma. Again, the intersection between the frontal and the sagittal suture known as Bregma. Next question, Lambda. We got here sagittal suture. We got here lambdoid suture. Between two parietal bone, sagittal. Between the parietal and the occipital bone, we got here the lambdoid suture. So the intersection between the sagittal and lambdoid suture known as lambda. The Greek word, it is representing the Greek word lambda, so that is called lambda. Now we got here the next question, all the foramina from the inferior view and the structure passing through. So first of all, we can see here the incisive foramina, just posterior to the teeth here. It is letting the nasopalatine nerve and the sphenopalatine vessel to pass through. Let's come to this point. We got here the greater palatine foramen anteriorly, a little bit posterior the lesser palatine foramina. So respectively greater and the lesser palatine nerves and the vessels passing through this foramina. We got here the pterygoid canal. Pterygoid canal is letting the pterygoid nerve and the vessel to pass through. And a little bit posterior here, we got the foramen lucidum, which one is filled with the cartilage. We got here the foramen ovale, which is letting the mandibular nerve and the lesser petrosal nerve to pass through. Foramen ovale, because its shape is oval. Lateral to the foramen ovale, we got to the foramen spinosum. Foramen spinosum is letting the middle meningeal artery to pass through. Coming down, we got here the carotid canal, very prominent. Carotid canal. The internal carotid artery and the nerve plexus is passing through. A very big foramen here, we go the foramen magnum, is letting the continuation of the brain and the spinal cord, vertebral arteries and the nerve plexus, anterior spinal artery, posterior spinal artery, roots of the accessory nerve, which is number 11, and the meninges to pass through here. We got here beside the condylar canal is letting the emissionary veins to pass through. We got here the both side of the condyle, and lateral to the condyle we are having the hypoglossal canal. Hypoglossal canal is letting the hypoglossal nerve, number 12 cranial nerve, and the vessels to pass through there. We got here the jugular foramen, very prominent. Jugular foramen, letting the internal jugular vein inferior petrosal sinus, glossopharyngeal nerve, vagus nerve, and accessory nerve to pass through. Between the styloid process and the mastoid process, here we go to foramen. We call that stylomastoid foramen. Stylomastoid foramen. So it is letting the facial nerve, which is number 7 cranial nerve, to pass through. Next question, name the 3 divisions of the cranial fossa. Cranial fossa we can divide into the 3 parts: anterior, middle, and posterior cranial fossa. Anterior, middle, and posterior cranial fossa. Next question is the hypophysial fossa. Hypophysial fossa is actually the depression on the body of the sphenoid in the middle, where the pituitary gland is staying over there. Next question, what is the workhorse of neurological examination? We got here computed tomography, also known as CT scan. Next question, what is a powerful tool in the assessment of carotid stenosis? So first of all, I would like to explain to you what is carotid stenosis. Carotid is the vessel, so stenosis is a narrowing. So narrowing of our carotid vessel is known as the carotid stenosis. So powerful tool in the assessment of carotid stenosis is the magnetic resonance imaging, also known as MRI in the short. We got here next question, why the ultrasound is useful in children in assessing the brain. Ultrasound is useful in children because they have an acoustic window through the fontanelles, so that's we can use the ultrasound there. Next question, define depressed skull fracture and the compound fractures. The depressed skull fracture in this diagram we can see here is a depressed skull fracture. A bony fragment is depressed below the normal skull convexity. A bony fragment. Okay. This may lead to the secondary atrial and the venous damage with the hematoma formation. And the compound fracture is a fracture of the bone together with the breach of skin, which may allow an infection to enter. Typically, these fractures are associated with the scalp laceration and can usually be treated with the antibiotics. Important complications of compound fractures include meningitis. Thank you.